welcome everybody. My name is Mark Graban. I'm the president of a company called Constancy Inc. There are other organizations I'm affiliated with. I'm the author of a number of books, including my most recent book, Measures of Success: React Less, Lead Better, Improve More. That was published last year. And we're joined today. Chris, if you want to introduce yourself briefly.
Hi, I'm Chris Chapman. I am a lean, agile software consultant here in Toronto, Ontario, Canada. I own, and I'm the chief cook and bottle washer of Derailleur Incorporated, a company that I launched in 2010 to begin teaching and coaching organizations on how to improve their processes. And that's led me to study of folks like W. Edwards Deming, Russell Ackoff, and Don Wheeler. And so that's what brings me to this presentation today. Is it's an application of some of the things I do in my line of work to something a little extracurricular.
Mm-hmm. So our topic today, as you see here, is getting from data to analysis and insight in the COVID-19 pandemic. I invited Chris to do this webinar together with me. He's been posting a lot of really good analysis on LinkedIn. And so I asked Chris to share sort of an extended version of his lessons learned from all of that. Chris and I also collaborated last year on a workshop that we co-hosted and ran on some the topics that we're going to discuss today. So I'm really excited to be here, Chris. Thank you for being part of this today.
Thanks for having me. This is excellent. Totally excited.
So the agenda here, I'm going to present for about 12 minutes, a quick introduction to using process behavior charts. This is going to be very introductory, hopefully jargon-free. We'll provide links and references for deeper dives to learn how to create process behavior charts and the details on the formulas. But today we really want to talk more about the use and application that we think is really applicable in a lot of circumstances, including what we're looking at right now. So then Chris is going to give a deeper dive for about 30 minutes looking at his analysis of COVID-19 data in the province of Ontario, and we'll do that Q&A. So I just want to introduce what we're going to be sharing and talking about today as a methodology that Professor Don Wheeler, his PhD statistician, Dr. Wheeler refers to a methodology called a process behavior chart. And I think it's a great name because it is a chart that helps us understand the behavior of a process. Or Chris, you would say process, right? But we call it a process behavior chart. This goes back, there are many names for this type of chart. A process behavior chart is a more specific, particular version of what Walter Shewhart, going back 100 years ago, dubbed control charts. And then along the way, there are many different types of control charts that could be used. But W.J. Jennett is credited with creating what is called an XMR chart, for the X and moving range chart. This is sometimes called the control chart for individuals. But Don Wheeler is credited with really sort of rediscovering this methodology. The XMR chart dates back to the 1940s. Dr. Wheeler started writing about this in the 80s. And Don Wheeler's books, what I would call the introduction, include the book Understanding Variation, The Key to Managing Chaos. And then if you want a deeper dive, his textbook, Making Sense of Data, SPC for the Service Sector, I think is a really good option there. So again, Understanding Variation, a nice, quick, easy read for people in any business. So as we learned from Dr. Wheeler, what's the purpose of a process behavior chart? Arguably, it's to help answer a key question. Has a change occurred in our process, in our system? Has the system changed? Maybe due to some outside factor that is out of our control. It's not something we did, but it's something we discover and react to appropriately. But then we can also answer the related question of, have we improved the system? So there are some systems, particularly in workplaces, where we are going to take actions that are intended to improve performance and boost the level of performance. So we can use process behavior charts to help gauge cause and effect. Was a change really a meaningful improvement to the system or not? So before we share examples of process behavior charts, we want to kind of level set what happens in many organizations. This is kind of a common discussion that happens in leadership team meetings. And I'm going to set some context. My friends at Memorial Health System in Ohio have really been using process behavior charts. And they've been doing so in the context of their management of preparing for what might have been a wave of COVID-19 patients. So they were trying to avoid behaviors like this, where somebody in a meeting might say, the number of employees out sick yesterday went up from 4 to 23. That might be factually correct, but it's missing a lot of context. What does that mean? People might say things like, I don't like that trend. Well, we don't know that that's the beginning or part of a trend. It could be just fluctuation in the data. Someone might ask for an explanation or go investigate, or they might say, go find the root cause. And without context, we don't know if there is a root cause to be found. This type of reaction to single data points or a comparison of two data points is quite often just not a good use of time. So if people might say, okay, fine, we're not going to react to every up and down. Let's look at more numbers instead. So a lot of organizations may display a table of numbers. So we see here, well, there was an increase from 4 to 23, but before that, there was a decrease from 19 to 4. So we want to try to put our metrics into context, and looking at a list of numbers is arguably not a good way for people to kind of comprehend what's going on. So we could do what my friends, there are people in the NHS in England who use this process behavior chart methodology, and they use a hashtag on social media. They say plot the dots, which is great advice. So even if we were to just create a run chart, and we can see the increase from 4 employees out sick up to 23, and we can see it was preceded by this drop, and we might start thinking, well, maybe this number, the number of employees out sick, is just fluctuating around an average. So when we build from the run chart, as Memorial Health System has done, we build what's called a process behavior chart. The one thing that we do is calculate an average and overlay that as a green line. And we can start to look and say, well, maybe that is just fluctuating around an average. But then we calculate from the data the red lines that you see here. We can call this an upper limit and then a lower limit, which are roughly plus and minus 3 sigma around the average. Now, in this case, the lower limit might, practically speaking, be 0. But when we look at the process behavior chart, and this is called an X chart. So of the X and MR chart, the X chart shows the data. The MR chart is a companion chart that shows the moving ranges. And we're going to leave that out of the discussion today because, again, this is a sort of introductory discussion. But when we look at the process behavior chart, and we evaluate it, and we see, for one, that there are no data points outside of those limits. We could say the chart and every data point we see here is characterized as being nothing but noise or common cause variation. We could call this routine variation. There's literally nothing to react to here. And we could look and say this is a predictable system. Now, one advantage of a process behavior chart is that we can use it to predict future performance. If nothing changed here, the number of employees out sick would range between 0 and 34. And Memorial Health System was using that understanding to make sure that they weren't overreacting to every up and down. And they were trying to use employees out sick as a predictor of what might be a wave of COVID-19 patients coming. So what about moving averages? A lot of people would say, and we see this a lot in the media right now, well, moving averages would help tamp down some of that variation or maybe prevent overreaction to it. So here's a run chart with a 5-day moving average. I mean, the 5-day moving average does smooth things out, but I don't know if it really adds that much more insight to the system. But what happens if now we have an additional data point? Now, this is a what-if scenario. This did not actually happen at Memorial Health. We see this data point, we're like, well, is that a meaningful spike? You can see the moving average blips up a little bit. It's a little harder to know what to do about that. What do we do about this data point here? Now, a process behavior chart thankfully helps answer that. So when we bring a process behavior chart back up and we see that this data point is above the calculated upper limit, this is what we would call a signal. So instead of noise, we've identified a signal. And instead of common cause variation, we might call this special cause variation. There is a special cause. And the health system might have said, okay, now that point is worth reacting to. And they may have said, well, maybe we need to mobilize some plans where this may be a prediction of a wave of COVID-19 patients. So they were trying to use this as an early indicator leading metric of other changes that might be happening in their system. So I want to thank Memorial Health System for sharing the examples of how they used process behavior charts to help monitor an ongoing performance measure that was meaningful to their organization. And then I'm going to share two charts here that come courtesy of Duke Health in North Carolina. They're private diagnostic clinics, part of the organization. So they have some ongoing metrics that they have been applying the process behavior chart methodology to. So one of these is an overall doctor rating, the percentage of patients who give a 9 or a 10. And we could say that this is a predictable system, but there are occasional outliers, and then there have been shifts in performance. So here we see a data point that's just slightly below the lower limit. This would be an appropriate time to ask why. What changed? What was different? Now, if you look at the x-axis, you can see that this is the week between Christmas and New Year's Day. So it very well could be that there was a very low volume of patients, and then the metric is just more sensitive to that low volume. So that was a temporary effect, and we see once we got out of they got out of the holidays, things started kind of fluctuating happily around the average. And then at the end, we can see outlier points above the upper limit. Now, they do realize that some of the most recent data points are maybe at best preliminary data points, and they've learned not to react to these initial readings until they get more surveys back from patients. But the thing I want to highlight here is first here with the orange box, and then here, a run of 8 or more consecutive data points above or below the previous average is indicative of a shift in performance, and again would be labeled as a signal, which likely has a special cause. And I know the organization has, I think, a pretty solid theory about the cause and effect relationship between intentional changes they made in their system that they think led to this boost in performance. They made a change to the system in June of 2019, and they did so again roughly the beginning of October 2019. So again, we have signals. We don't want to react to noise. We do want to try to understand and explain signals. Another metric that they look at is what they call abandonment rate, the percentage of people who call into a central call center and then basically get frustrated and hang up. So I would call this one a less predictable system because you can see there are a number of signals that occur over time. It would be appropriate to ask what was different those days. But then again, we see evidence of a shift downward in performance that started here in mid to late March. Well, I think they have a pretty solid theory that what happened there was the beginning of the pandemic. Far fewer patients coming in for care, far fewer phone calls coming in. And with fewer phone calls, it's reasonable to think that there would be fewer abandoned calls. Now, I think their theory would say that once things start getting back to normal, unless they're able to improve their system, that performance would probably shift back up to where it had been. They cannot claim that this is the result of process improvement. This is the result of an external change to the system. And we see these last data points here that we've got, 6 in a row above the average. As things are starting to get back to normal, this might start creeping back up. So those are the examples I wanted to share. I'm going to hand things over to Chris, who's going to share his screen and sort of take us through the next section for about 30 minutes or so. Here you go, Chris.
All right, thanks, Mark.
Chris knows how to share his screen, so thank you for that.
Excellent. So thanks, Mark. Now, what we've seen, Mark's provided us with how healthcare institutions use process behavior charts when they are within the system itself. So they're looking for identifying opportunities for improvement. They're looking for opportunities for how the process is actually behaving now and how we could predict it in the future. My aim with what I'm going to show you today is how can you use process behavior charts when you're outside the system, when you're wanting to exploit how can I interpret or understand a system when I'm not a direct participant. So that's what we're going to do right now is we're going to look at how I undertook an analysis of Ontario's, my home province's, COVID-19 response system data. Let's get that. So before I go any further, for folks that I understand, we've got a lot of folks from around the world who are watching this webinar. Where is Ontario? Well, it's kind of smack dab in the middle of Canada, and it's one of the most populous provinces in the country. It has 14 million people. It's about 3,400 miles, 5,400 kilometers across, has a GDP of about $530 billion US. And each year we spend about $43 billion US on healthcare. And that's a number that never goes down, it always increases. Current stats on where our COVID-19 response has been so far is we've got 28,263 cases that have been identified. And of those, 22,153 have been resolved. And thankfully, though it's not great, 2,276 deaths. It could have been a lot worse, but so far we've been very lucky, I think, with how things have turned out. So we're going to be talking about, and yes, here's Toronto and here's Ottawa. I should mention the two capital cities. So Toronto is the capital city of Ontario. Ottawa is the capital city of the country. So the federal legislature you'll find in Ottawa, the provincial legislature, which is responsible for the system I'm going to be talking about today, located in Toronto, and that's where I am as well. So before I go any further, we're going to be talking about the COVID-19 response system, but we need to level set on what do I mean. We need an operational definition about what is a system. And I'm going to fall back to someone who's been very influential to me, W. Edwards Deming. He says that a system is a network of interdependent components that are going to work together to accomplish some aim. And if you don't have an aim for those components, then you haven't got a system. You just have a collection of parts that happen to be co-located. And perhaps most importantly, this system has to be managed. So what does this system actually look like? Very grossly simplified. We have what you could kind of say would be the equivalent of the CEO role. Let me just get the laser pointer here. Vested with the premier. That's a political elected position. He has a Minister of Health, and there is an arm's length agency that's called Public Health Ontario, which is responsible largely for the scientific side of healthcare management. So they will do a lot of the testing. They've got 11 labs that they provide oversight on, and they'll also engage with universities. They'll partner with other institutions to provide the Premier, the Minister of Health, and other officials with guidance and advice, scientific guidance and advice. And they were some of the first people to be activated when the crisis broke. Beneath them, we have across the province 32 public healthcare units. So these are divided up region by region. And what they are largely responsible for is providing information and services that are outside of the hospital setting. And in the COVID-19 response, they've been largely responsible for the administration or distribution of test kits, and making sure that they're getting out. And they're also responsible for aggregating and collecting statistics. In the rest of the province, we have around 492 public hospitals. And as we'll see very shortly, our system has been augmented by independent and private labs, whether they're located in a hospital setting or they may just be located outside, 325 of them. Linking all of these together is a system of communications that you may find astonishing. We don't have a centralized electronic healthcare reporting system. We tried to do that about 10 or 15 years ago, and it didn't work out very well, and so we're still trying to augment that. Some of the parts of this system are literally held together with couriers, electronic communications like email, telephone, fax, and in some cases, yes, even post. So this is the nature of the beast that we're going to be looking at. Now, What is it like, or what began my motivation way back in March when the crisis was first starting to try and understand it better, is not only my predisposition towards systems thinking and the work of Dr. Wheeler and what Mark's done with process behavior charts. I'm just oriented. When I get a string of data, I want to put it in a PBC so I can begin to understand it. But this is how we're typically informed each day. So about a month ago, 568 new cases. It's the highest increase ever. Well, now we've got the lowest number of cases on May 9th. Well, that must be good. But then we had the highest jump ever again in 2 weeks. So the Premier said that was pretty concerning. But then we reported the lowest number of cases since the end of March. Well, are we getting better or are we getting worse? It's perplexing our Chief Medical Officer of Health. He reacted to a count of 477 new cases and the fact that we weren't achieving 20,000 tests per day despite expanding testing capabilities. When you don't have good theory to explain why numbers change, you'll attach just about any meaning to why. And this is perhaps the most egregious one that's ever been floated. We had a case where, and we'll see this in the process behavior charts, where we had 5 days in succession, daily reported cases over 400. And that was attributed to people, blaming people for perhaps being too lax in their Mother's Day celebrations. But not to worry, things got better. We went down to 292 cases. You're probably getting the picture here. Now, there's also a case where, and this has probably been the most politically sensitive, around how many tests are we actually capable of doing. And on one famous day in May, the Premier was challenged. And this is a great example of seeing how the media plus the leadership, using the same mental models and lenses to interpret information, work like an Ouroboros, and they fit each other. So this reporter asked, Premier, why did the numbers of tests drop from 17,000 on Sunday to 10,000 today? She's asking for an explanation on the fluctuation of the figures because she doesn't have a way to explain why the numbers fluctuated. Neither did the Premier, though, nor his leadership. They said, well, I've got 32 medical officers of health, 16 are above average, 16 are below, and they know who they are, and they've got to start picking up their socks and start testing. Not helpful. So, of course, there's been investigative reports around why is it so hard for us to get our test numbers up. And this was actually probably the best article that I've actually read. A Toronto Star investigative journalist, Kate Allen, put together where she went through chapter and verse some of the reasons why, and it's the components of the system. It was actually a system that was being built in flight to try and accomplish these numbers. So it's very interesting that there's only been one report I've seen in 3-4 months. And just recently, we had a red letter day where we finally did achieve 20,000 tests. Hooray. 20,640. But the question remains, is this something that's sustainable? Where do we know that this fits within the context? All that we know is we could break out the champagne. This sums up my interpretation of what I think is happening in the media and also with the leadership of the province. We're engaging in something I call last data point analysis theater. We're not really progressing our understanding or knowledge of what's happening because we forget the context, we forget the history. So how can we disabuse ourselves from reacting in this way in last data point analysis theater? Well, it's got to begin with changing our frame of reference about how we think about the relationship between figures and events and systems. So Don Wheeler, he has a fantastic expression. You'll read in all of his books. He's very forthright about this. The first thing we need to do is understand data apart from their context have no meaning. We need to stop looking at just 1 or 2 data points and look at a succession of data points in context. Next, we have to reset our thinking about when we observe a number fluctuating or a figure fluctuating and something occurring and making the human conclusion that the two are related in some way. So Gypsy Rani provided fantastic guidance on this, a maxim I've held for a number of years, not to confuse coincidence with cause and effect. This is the motivation for using a PBC so that we can validate, is there really a connection? Is there really a signal for us to interpret? And the next thing is we need some rules that are going to help us be able to separate signals from noise inside of the data. So Mark spoke earlier in his charts about common causes and special causes. The primary motivation for using a process behavior chart, and why this has gone back as a technique 80 years, almost 100 years, is that we make mistakes. Leadership and citizens alike will misinterpret when a number fluctuates and attach a significant meaning to it. Or we'll do the opposite. There will be some special causes that will come up in the figures, and we'll misinterpret it as just normal. We can't eliminate making one or the other mistake. That's always going to be our foible. But without some way to be able to recognize them, we're not going to be able to have a cogent response. So my proposition is this: let's dispense with last data point analysis theater. When we get information and data from our systems, let's visualize it in context and over time, and use the process behavior chart methodology to monitor it. And what we're going to do is look for patterns and signals so that we can generate some insights, even if we're outside of the system. So I've got some suggestions. What you're going to see by example are some of the patterns that have come up in the media and have been reported, and we're going to try and see if we can find some validation to it. So mid-April, we were boosting our COVID-19 testing capacity to reach almost 20,000 people a day by mid-April. What effect did this announcement have? How did we achieve that? Or how did we progress towards it? How about changing the way that we test? So there was a distinctive point where on April 15th, and this wouldn't have been known, this wasn't very widely reported either, we changed how we were reporting COVID-19 test samples. And it went from one test per individual to now total test samples taken, where you could have multiple test samples that are taken in a day. So we're going to see how that plays out in the process behavior chart. Next, we decided to undertake testing because, of course, what we had here in Ontario was the outbreak affected for a while disproportionately long-term care facilities and healthcare workers inside of those facilities. So an effort was undertaken between April 23rd and May 15th to test every nursing home resident. There are about 624 nursing homes in the province. So what effect did that have? We're going to test the Mother's Day celebrations hypothesis. And then finally, my favorite, the Tuesday jump. Data points must jump out on a Tuesday because fewer people work in the labs over the weekend. So you're going to have a big batch and you're going to see that squirt out around Monday or Tuesday. Why not? Let's see if it's true. So 3 aspects of this system that we're going to look at. We're going to look at, and this directly comes from the figures that the province publishes each day. So we're going to look at it from taking a test sample to analyzing the test sample to reporting the new cases. In between, there are going to be delays. So getting the sample to analyzing the sample, we're dealing with couriers and communication issues. Between the test sample and the reporting, communications is probably the largest delay, but we're also going to have data entry. We're going to have a lot of other delays that are going to be put into that as well. And you'll see that we're going to cover these charts. So let's start getting into that just momentarily. So my method is this every single day. On the left-hand side, you see what I call a tear-off. And Mark is going to provide a link to this so that you can actually tear these off yourself. And you can see how the province reports this. So we get a table of data. It's not very easy to consume. What I do is I take that data and I update a spreadsheet in Excel and I start creating visualizations from it. I do the calculations to put the process limits on, put the averages on, and put targets on, and I begin to see what is what from the data. Human beings process visual data far more quickly than tables of numbers, and we're able to see patterns much more readily and evidently. So my process has been to try and augment that. So let's begin with the first stage, test samples drawn. So some observations about this particular chart. We're going to notice that we've got process limits. And they don't look nice and neat and tidy like the ones that Mark showed you. They look rather chaotic. And this isn't surprising because this is a system that's been in transition and change. And we can see that every time it's shifted, this corresponds to a change in the processes and the systems involved. And they're sometimes significant. So you can see I've mapped out 6 changes that have occurred. And there's potentially, if you look over here, potentially a seventh one that could even happen as the data, I have to wait for more data to come in to be able to determine if that's a real shift or not. I've also added some target lines. So depending on who you talk to and which media outlet is participating, you're going to hear rather confusingly as an Ontario resident and citizen, a range of numbers. So they start kind of down here around 16,000 per day was supposed to be, and even today you'll hear that figure used. Then you'll hear the 20,000 per day figure mentioned. So we just saw that in some of the news clips. And then there is the supposed theoretical capacity of 25,000 per day. And the confusion for the citizen is, well, how well are we actually achieving those targets? When are they being achieved? And you can see right over here, we've got some data points that have aggregated in this period to go over the 16,000 mark. And here's our latest one going over 20,000. But we can see that it's not something that's sustainable. There's a lot of variation that's contained in these curves. And it's rather interesting to see that. We also see that there's some interesting patterns, and there's looks like random jumps and noise here. But then it begins to start to take on this very interesting up and down valley pattern. And then we see that pattern beginning to get repeated here. This is a reflection of changes that are occurring inside of the system. Important thing to remember, Deming, among many others, would remind us that when we set targets for a system, it can introduce distortions. And potentially these targets have done this very distorted pattern. We don't know yet. So here's where the province decided to expand testing to include independent labs. And you can see there's a bit of a lag here until the next shift occurred. Now, I've been able to fill in the blanks and understand why. And this was occurring because the labs were having to acquire new equipment and we're having to ramp up to be able to process the tests that were going to be happening. So it's interesting to see, well, if we demarcate this, what changed? Here's the demarcation point when the province began changing how they reported tests. Now things start to get rather interesting. We can actually see the variation patterns shifting and changing in response. It's rather coincidental that the cleavage point seems to happen right there. Well, let's look at the period of comprehensive long-term care testing. That definitely seemed to have an impact. More and more tests were being done. So we could say, yep, I can see that. The Premier's admonishment, and where he had the challenge with the reporter, this is the 10,000, this was the nadir of this particular period. He was called on to explain. And you can see, well, if the Premier was advised appropriately, along with his leadership team around processes and variation, he might have been able to explain to that reporter, hey, it's not great. We're trying to improve the system as we go. This is statistical variation that we're seeing. And of course, here's the Mother's Day hypothesis that's going to kick in here. We see that, yes, tests did begin to increase after Mother's Day, but it takes almost 2 weeks for symptoms to present. So we would expect to see symptoms presenting after that. Well, you would say, well, that would probably fit right around here. But this also happens to coincide with another bit of tampering that occurred, and that's what we say happens inside of the system when changes are made without insight to what effects they could have. The Premier announced on this day that testing would be available for everyone. If you felt like you needed a test, you didn't need to wait, just go down to a clinic, go get yourself tested. So we can see that that definitely did have an impact on the number of test samples that were taken. So it begins to obscure cause and effect analysis. We actually have to look at it in context and with some augmentation of events. What did occur? So let's look at another part of the system, and this is the backlogs. This is underreported. I do not find this I only found backlogs really talked about maybe a half dozen times or so in the media. It's certainly not as sexy as the daily new cases that gets everybody excited. This is the companion, and this is perhaps the most interesting. In software development, we talk about these things all the time because queues are very important for us in understanding how we get work done. But it was interesting to me to see just the difference in patterns here. The backlog system itself has got 9 different fluctuations that we've got, or 9 process shifts. And they come in 2 distinct patterns. You'll notice that over here, this pattern seems to be very orderly. It goes up, it goes down. It's almost remarkably mountainous. And then it descends into this valley for a short period of time. and then the amplitude shifts in the variation begin to take off. And that kind of corresponds to the increased testing. But we see again, shifts in the pattern. And we see the normal routine taking place. But this is not something that we would say characterizes a stable and predictable system. This is unpredictable, and this is quite chaotic. So trying to divinate anything from this beyond looking at the patterns is risky at best. This just allows us to see, well, this is how it's actually working. So let's put on some stuff. Let's figure out how this was affected. Here's the demarcation point for the province expanding testing. So this climb has a very good reason. This is where the provincial labs, and there were only 11 of them, began to get overwhelmed with the backlog of tests that were being done at the time. And the province expanded the testing to include 325 labs. And you can see, well, that produced a commensurate drop. That seemed to work out well for them, but then it just went completely off the rails again with huge swings and variation. And I think this is coming from different types of testing equipment that is being used, different delays that are inside of the system, people coming and going. We have a presumption that the people who were administering things here are the same people administering things here. And we do know that leadership and management did change in here. So we began to see these wilder fluctuations. Here's Mother's Day and the comprehensive long-term care testing. Definitely the queues backed up. And there's the impact of the tests for all. It began to increase the backlogs. So the throughput was definitely declining. There is a defined limit for this system to be able to process tests. So this led me to put this together because some of the commentary that I would hear in the media and that I'd hear on Twitter, for example, we're not testing enough. We need to be testing more people. We just don't seem to be reaching our numbers. And it became almost a bit of performance theater or success theater that we needed to hit the numbers so we could find more people. And it's interesting when you overlay daily new tests with the backlog and then daily new cases underneath. You can see that right away there's not really a correlation that you can make. When you don't have good theory, when you're not visualizing the data, you will attach any meaning to correspond these. So I'm quite certain that in the way that our system is structured right now, there is a disconnect. It is not a direct relationship between daily new cases and the outcome of the testing system. But it's very interesting to me to see that we have a corresponding correlation or a sympathy almost between the daily new tests and test backlog, which suggests these systems are more closely managed than we might think. And considering it's coming from 32 different public health units that are all collecting and aggregating data and reporting it into the province's IFAS database, this is rather remarkable that it follows these curves so closely. In software development, we would say, yeah, there's probably some batching and queuing, which is corresponding here and why we're seeing the shifts. But it's still, this is something that I haven't heard discussed either by the province or the media. It seems to just go critically unreported. Hey, this is something that's really, really interesting. So finally, let's look at the number that gets everyone going every single day. This is the process behavior chart for the daily new cases figure. This is the one where if it goes up, down, does a run, we get the most interest in. So what do we observe in this particular chart? Well, we see that we've got 6 process shifts again. It's not surprising that in the early part or the early stages in March, we're seeing these rapid shifts as the cases are coming in. And in fact, if you fit these on an exponential curve, you'll see that they kind of go in that direction. But then the system suddenly recalibrates and goes into this new set of periods of stable, predictable variation. This last period here, 6, this one began on April 28th. And this is the pattern that has persisted to this day. It's between 532 and 232 cases per day. And when I place it in context of understanding the prior to process behavior charts, this is what leads me to believe that this is not a daily metric. In other words, it doesn't mean each data point here means that many people were identified as having COVID-19. Because of the delays in the system itself, this is what we would call the reporting system being exposed here. While there are real people behind the figures are not are only corresponding to what happened in the reporting system itself to aggregate it in the last 24 hours. So let's test one of those hypotheses that we talked about. What about that Tuesday bump? Well, do figures really jump every Tuesday because of delays in the reporting system? Well, we can see, well, not really. I mean, you could presuppose that here. You could mildly presuppose it here, but what about here? The theory begins to fall apart in a number of places. So that's not a really good explanation, but it made for good news, right? And it began to take on a life of its own because everyone just assumed that the Tuesday figures were because of delays and lags in the lab reporting. Well, okay, maybe comprehensive long-term care testing caused a jump in COVID cases being identified. Well, maybe. We certainly did. We started at a point where we had the highest number of cases identified. I think this was 640, I believe. And it began to precipitously drop. It's just variation. It began to actually go into a new period of variation where it crossed the limits. And then we settled into this regular routine noise. And it's very chaotic and noisy between these limits. It's a wide swing of 300 cases. But there doesn't seem to be a correlation there. Maybe there is, but we're not seeing it. So there's Mother's Day. Presupposition. Mother's Day, too many people congregating should mean more cases. And certainly that was suggested when we had 5 days of over 400 cases per day. But these don't really represent, as I've said, what cases being identified. We don't have a good explanation for this beyond statistical noise. So it rather casts some shadow on how solid the Mother's Day hypothesis would be. All of this I'm beginning to realize and reveal as I plot the patterns. And I publish these every single day. I update them, I publish them on Twitter, and I interact with people about the results I'm seeing because no one else is providing this analysis. I'm learning things even though I'm having to reconstruct a lot of my understanding and knowledge post hoc through looking at news reports and doing a lot of research. So I want to touch on this particular part right here, this run of 5. Mark explained in his session or part of the presentation about the dangers of rolling averages. So I decided to put a rolling average on my data and see what happens when I follow this line through that run. So 1, 2, 3, 4, 5. These are the run of 5 data points over 400 cases per day. And it was presaged that it meant bad things were on the horizon. So the open question is, what does this trend line cause us to think? What does it make us interpret? And it might suggest to somebody, well, it's either going to stay flat or it could go up. So what happened? What were we missing? If we weren't putting this on a process behavior chart, we wouldn't understand that we could have any data point land between these limits and still be normal. We could even have a signal that might occur above or below. We don't know. So it would be rather foolhardy to rely on a trend line. Here's what actually happened. We went down to some of our lower numbers. These are in the 200s, the mid to upper 200s in terms of cases. The pattern of variation persisted. I knew, because I've been charting this for a long time, that this is statistical noise. This is not a signal. And what's worrying is that there may have been decisions that were made based on that trend line, which is going to introduce perhaps some more caustic variation into the system, and we could see some wilder fluctuations in other places. So let me sum up. What did we just go through in this basic analysis? We've seen that you can, even if you're not inside of a system, if you're monitoring the system, we can begin to get some insights. They may be imperfect, but they are certainly better than the analyses that, at least here in Ontario, we're being provided with when we look at data points in outside of the context of their peers. So we investigated the Tuesday jump hypothesis, found it wanting. We observed how the change in test samples were reported on April 15th. We observed how it went from this rather ordered chaos to wide amplitude shifts of variation. It had an effect, and that's precipitated an increase in the backlog. So we're seeing how that system was being managed. We threw a little bit of shade on the Mother's Day gathering causing spikes in cases because it's not really firmly established whether that really is the case. And it's even harder to make that case when we know that the daily new cases number is not as clean as it could be. We also noticed that there is sympathy when we overlay the curves between test samples taken and the backlog. We see that there's some sympathy between the curves. So we're getting some insight and understanding because that was provoked by the process behavior charts to do that. Say, well, maybe we can understand how the test sample system and backlog system is working and why there are delays. And then we noticed that there is definitely a disconnect between the test samples and new cases. More test samples does not equal more new cases. In fact, it just seems to introduce statistical noise. And finally, I looked at what 5-day moving averages tend to leave out of the analysis and how they can introduce more variation if we're not careful. So that's pretty much a sum and total about how I do my analysis on COVID-19 each day.
Thank you, Chris. And we're going to jump into Q&A. I'm going to share my screen that's going to have our contact info. So you can see our contact info there. If you go to measuresofsuccessbook.com/COVID, we're going to have the slides and recording and all sorts of information there. And Chris, we've got a lot of questions. So to the attendees, if we run long and you have to jump off, we are going to record the entire session if you want to go back and catch up on Q&A that we won't get to by the top of the hour. But, Chris, I just want to thank you for sharing those examples because like some of the things that resonate with me, just to give a bit of a recap, is that we have to be careful, whether it's news headlines or management reports, when we hear about something being the highest in X number of years or the lowest since whatever. Like those statements may be true, but they're not necessarily statistical signals. And that's why we have to look at a process behavior chart. And I think as you show, the purpose of the charts is not to technically correct charts. The purpose is to get insights and to help see when system changes led to changes in the metric, or when sometimes the system change ends up not having an effect on the metric. And then we can use those process behavior charts to predict future performance as we continue to separate signal from noise. So we had one question here. You're not using trend lines. Any reason why? So I'll take a swing at that. I think linear trend lines are used quite often in charts, and those can be very misleading. I think linear trend lines run the risk of making a very bad future projection about performance. It's really highly open to manipulation. You can cherry pick data points out of any data set to show, sometimes in the exact same data set, linear trend going up, linear trend going down. I think what we see most often in business metrics is periods of fluctuation around a flat average and then some sort of shift. So that's why I tend to be really cautious about linear trend lines. And I'll add a blog post about that to the notes page. Anything you would add on that, Chris?
No, I agree. There's actually a companion question to this too that I screwed up and said was answered live. I clicked the wrong button from Jeff. So the companion to this one asked, the average plus or minus 3 sigma is based on a standard distribution. How might you account for a Weibull distribution? How might you account for this if Weibull is one where k equals 0.75 to k equals 1.5? So 3 sigma is not based on the standard deviation, is the first point.
Right.
Second is, I just posted, and maybe I'll post a link to this as well because it'll provide some more in-depth analysis. Don Wheeler did a blog post a couple of years ago explaining how data does not need to fit models in order to benefit from having a PBC analysis.
Right.
So he actually overlaid 19 different models, of which Weibull was one of them. And he said the 3 sigma estimates, all of the models fit between. So if your point is, he has a great phrase and expression, PBCs are not about improving your practice in arithmetic, they're about finding signals. So you've lost the plot when you start working on finite, very fine points around the arithmetic and models. Models don't generate data, processes and systems generate data. We're on the hunt for signals so that we can understand and improve them.
Yeah, and just elaborate on that because it is a very commonly asked question. We don't need normally distributed data. We don't need to make assumptions that other control charts would make about the underlying statistical distribution. those assumptions are often really bad assumptions in the real world. So the beauty of the XMR chart methodology, like Chris was saying, it's very robust with real world data. And then, there's another question here, and there's two parts to answer to this one, Chris. As new data become available, when do we include that in the calculations? So, it's not the standard deviation. We estimate sigma by using a formula that includes the moving ranges, which is the absolute difference between the ups and downs in the data. We'll have deeper dive info about that on the webpage that you see there on screen. But to me, like when you add new data, like if I were to see a shift of 8 data points above the mean, I think what Don Wheeler taught me, don't be in a rush to recalculate the limits, because even if you still have the old limits, that signal is very visually apparent on the chart. And then if you see now that it's 10 or 15, and it seems like that really does seem like a sustained shift, the argument for recalculating the limits is to make now a better prediction of future performance, looking at a new average and a new lower and upper limit. So like when we go back retrospectively, like Chris did, you can shift the data based on what seemed to be, or what are the signals. But Chris, maybe you can elaborate, because there were a couple of other variations of this question of how did you know when to recalculate the average and the limits?
Yeah. So again, referencing Don's advice, it's not about math, it's about looking where the data takes you. So he has in the books that he's published, he has some fantastic guidance, and there's one that's called 20 Things You Need to Know, which I would encourage everyone to get. It's the companion to his first book, Understanding Variation. And he has a fantastic little chart in there that shows how many data points you need before the limits start to what he calls gelling and solidifying. So you begin to see that gelling and solidification taking place usually after about 10 data points. And then as soon as you go out to around 25 or 30, that's about the max. You're not going to get as much payback. So often we'll talk about how many data points do you need in a good baseline. Anywhere up to 25 or 30, but you need only as few as 6 or 7 to be able to pull out a signal.
Wheeler
sometimes,
even
sometimes 4. Yeah.
Better to have more data points.
So if I see, what I do is I recalculate the limits each day, but then I play a little bit. I'll pull the limit back, the calculation back, and I'll say, what's happening? Is there a signal really present here? And if I see that the data is now, yes, that is a signal, and it is the process is indicating a shift according to one of the 3 rules, then I will begin to recalculate and shift the limits. And that's where you'll see the red lines either go up or they go down, because I can definitely see that.
So then there were a couple other related questions. Do we follow the rules? I think the person asking meant the Western Electric rules on when to recalculate the average and the variances. To me, I think there's gray area in art to when do you recalculate the limits. Like, Wheeler, I think, teaches really clearly, like if you've had a signal or a shift in the bad direction, our goal is to go back and fix the system rather than being in a rush to recalculate the limits. There are additional rules, like Chris and I talked about the 2 main rules of looking for a signal outside the limits, a data point outside the limits, or 8+ outside, not outside, above or below the average. There are additional rules that you can add. And I used to use and teach the Western Electric rules, and there's also a set called the Nelson rules. Wheeler shows mathematically how as we add additional rules, yes, we'll find more signals, but we're also increasing the risk of false signals. And at some point, net, that stops being useful. So I've, over time, kind of gravitated to the keep it simple method. And that's a really effective way of finding, you could think of it as outliers and then shifts in performance. That's why, if anything, those 2 rules are really helpful. But Chris, anything you would add on that?
I'm just looking in the chat and I'm wanting to connect a point because it may not be seen. Balaji Reddy is noting here that when we talk about the limits, it's important to recognize they're economic limits, not statistical limits. So you touched on this in your part of the webinar, that this allows us not to waste time. And I think Don would use the expression, where is it most economical to go and investigate? So I often will use process behavior charts when I'm helping leadership teams understand how their software teams are working, because I can actually point out to them, if we chart for example, your defect rate, or if we chart your throughput day by day, and we see challenges that arrive there, instead of making you concerned about everything in that data set, I can point you very directly, what happened on this day? And, case in point, I had an incident with one particular customer where I noticed amongst a stream of data this defect rate that was up in the high 90s. And I said, well, what happened there on that specific day? And he said, oh, I can tell you what happened there. That's when we decided to close the shop down and just do bug fixes all day. And I thought, explanation. I didn't have to go and say what happened week by week, day by day. I had a very economical way to be able to find that signal.
Yeah, I mean, if you look at the history of the development of the XMR chart, and it's based on this evaluation of if we set the limits at plus minus 3 sigma, which again, not plus minus 3 standard deviations, but plus minus 3 sigma, that it filters out almost all of the noise. And when Chris was talking earlier about the mistake 1 versus mistake 2, the plus minus 3 sigma limits kind of balance out the risk. We don't want too many false positives, but we also don't want to miss. We don't want false signals. We don't want to miss signals. Let's see. There's another question here. What about using the same process behavior chart methodology for the infection rate, or the number of positive cases divided by the number of tests? So yes, I've seen a number of people post analysis like that on LinkedIn, looking at that metric. I think the argument is, as the rate of the infection rate goes down, it means that there's a better handle on the pandemic. But I don't know. I've drawn charts for counties in Texas and California looking at cases and deaths. Like I haven't found what seems like reliable data around that positive rate.
Yes.
So I guess with all things, like hopefully you've got data that you can trust. One other thing I've seen that's sort of interesting with plotting data like this is that, like, the most recent data point or two can be thought of as preliminary data points, because they inevitably change. So you have to be careful. Like the first time the state of Texas or Los Angeles County make updated data available, you can't assume that data point is static, because it changes as they get better information over time. And we can look and see how that's affected in the charts. But Chris, did you try chart? I mean, so the short answer to the question is yes. I think you can use. I've seen people use the process behavior chart for that metric, but
I've been reluctant to do that with the Ontario data, because as I've been able to go through and understand it, I don't have a high degree of confidence in the figures. So as I've mentioned with the daily new cases number, I know that there is so much noise baked into that. That's because it's a highly aggregated figure. So it's kind of akin to when you have, for example, a executive summary report that details how each department worked, and then it gets rolled up into a central figure. That's kind of what we have happening with the 32 public health units. So I've been reluctant to do that kind of analysis. I have taken the numbers and I've run them using a different kind of chart, a different kind of control chart that's called a C chart, which is when you have data that does conform to a particular model, when you know the distribution. So it allows you to fit the numbers against a predicted exponential curve. And the best that I got out of that was it followed the curve for about a month, and then it went straight out. It just went through the limits, and then it's just statistical noise at that point.
And you can use that more complicated method, and I think you start losing people when you start talking about logarithmic normalization. Yep. And, I think the purpose of the chart is to show, has the system changed? And that more complicated, more technical exponential chart with limits that are kind of going up around an exponential curve. Like you said, you see now that it flattens out, it goes below the lower limit, the system has changed. I could use I'm going to just click on, a different chart here. If I use the kind of standard process behavior chart methodology with flat limits, I mean, like maybe you could argue that this was exponential growth and then it stopped. Like I think there may be some data reporting issues going on here, but I think I would try to use the simplest method possible for answering that question of has the system changed?
Yeah.
So there's some other questions here. And again, for people who have to drop off, we'll share the whole recording. Here's an interesting question here. When you calculate limits after a shift, is there a risk that you're actually attempting to put limits on something that is wholly unpredictable? I would say, well, the chart tells us if it's unpredictable, if it's become newly predictable around a new average, or if it's wildly unpredictable. I think you have to chart it and then see what it says. I've had a number of people ask, or they were taught along the way somehow that, the system has to be in control before you put it in a control chart. I'm like, well, how do you know if it's in control or not? The control chart will tell you if you have a predictable system or not. But what do you think, Chris?
Well, I had that question come up early when I started sharing my charts on LinkedIn. So I had some interesting questions that were posed to me from some folks saying, well, how do you know the data is homogeneous? You can't chart apples and oranges, in other words. And I'm like, well, that's a really great point. I would agree that perhaps some of the data isn't homogeneous. There's a good chance it's not homogeneous. But the whole point of putting data into a process behavior chart is that'll become evident. You should see a lot of false positives, maybe some false negatives. It will become apparent in how the data looks, whether you're dealing with a homogeneous data set or not. And again, I'm on the outside looking in. I don't have the advantage of knowing minute by minute, day by day, what has changed inside of the system. So at best, I'm retroactively trying to construct an understanding of, okay, these signals occurred. Is there an explanation for why? And did that provide me any greater understanding than getting the past two data points fed to me through the media?
Yeah.
Answer, yeah, it does pay some dividend.
Yeah, and there's always risk of, let's say, you combine day shift numbers and night shift numbers into a single chart, and then you see this wild up down, up down, up down, up down pattern. You may really need two separate charts, one for day shift, one for night shift. Weekend days versus weekdays. Weekends may be a different system. You may have a rational reason for not including those data points in the chart. But there's another question here, and this comes up a lot. How do you handle autocorrelation in daily cases? And without trying to sound too flippant about it, the teaching from Don Wheeler is don't worry about autocorrelation. That all real world data is autocorrelated, and it's not something to worry about.
Yep.
Let's see. Will there be another webinar in the future that discusses the MR chart? I think the answer is maybe. If you go to the webpage, the link here, measuresofsuccessbook.com/COVID, I've got a recording of a webinar that I did in the past that was a deeper dive about how to do the calculations, how to create the moving range chart or MR chart, how to interpret that. But I don't know, in general, Chris, we may be able to do some follow-ups.
Yeah, no, I think that perhaps doing a deeper dive on how we calculate the limits and looking at cases where we make decisions about shifting and what happens as a result. But a lot of benefit, it can be intimidating for new practitioners. Like, how do I slice the data and how do I do the recalculations? But you can get enormous benefit just taking 25, 30 data points, calculate the first 10 or 15, and just look for signals. You'll get immediate payback there. You're going to know whether the data is in simpatico with its peers or not. And it's good to start playing with that almost immediately. Get comfortable with that first.
Yeah. So there's another question here. It says, and I'll have an opportunity to clarify something I had said, Chris.
Okay.
You previously recommended that shifting control limits should be done if the shift is in a favorable direction. Please explain. So I'm going to pull up a different chart. This is Tarrant County, which is Fort Worth, Texas, the reported number of deaths each day. So here's an example where sadly there was a shift upward. And I did recalculate the limits because I want to see now a new prediction right? So it's a higher average. There's a little bit higher variation. There's a higher upper limit. I did recalculate the limits. I think like in an organization, if we don't want to just become spectators of the chart where performance got worse, we calculate new limits and we move on. The point is to see that we need to go improve performance as a result of the signal that's shown on the chart. So we might have a reason to recalculate the average and limits when it's gotten worse. Here recently in Los Angeles County, thankfully, there's been what's arguably a shift downward in performance. I think there's a little bit of art. I think generally recalculate the limits when you see a signal that says there's been a somewhat meaningful and sustained shift.
Yeah, like typically if I see 8, 9, 10 data points now below the average, I know there's been a sub shift. And I can, now that I've worked with this long enough, I've got a feel for what's going to happen in the system. And it doesn't disappoint. It's pretty remarkable how consistent it is when you're dealing with consistency. So for example, in the daily new cases, as terrible as it is, I just know that those numbers are not representative, but I do know that we've got 31 data points to tell me that. I'm not seeing anything that tells me in the near future that's going to trend out.
So there's another question, Chris, maybe you can elaborate on. You were quoted or asked if you could say more about when you're not visualizing the data, you can interpret the data any way you like.
Yeah. So that was, that cuts to the primary motivation of why I decided to chart my province's COVID-19 response. Because I was seeing just about any explanation accorded to why the numbers would fluctuate. We'll see a news report that says today's results are higher than ever. And of course, it has to be due to people not following the rules, or it has to be, it trended downward. So obviously that means the things that we're doing are working. We're flattening the curve, but 2 days later, it's back up again. What I mean by that is if you haven't got a good theory, and when I speak about this, it's theory about processes and systems and variation. If you haven't got an appreciation for that relationship, when a figure fluctuates, you'll draw on what you call an availability heuristic. And you'll say, well, in the past, this kind of meant this. And when figures change, that means that somebody screwed up their job, or that means there's a spanner in the works. We'll explain it to ourselves post hoc. What I wanted to get away from was those post hoc explanations and say, well, what does the data tell us in whole? And what I was finding was it just separated. There was just no correlation that could be really made. The data just didn't support that. It's varying. That's it.
Yeah. Let's see. There's another question. Crucial question often is, as social restrictions are loosened up, does it cause a shift upward in spread of disease, which could be measured by the number of positive cases or the infection rate? How many data points would you say are needed to draw a conclusion to this question, and what should a public health leader do with the data point? So I'm going to come back to, if it's all right, here's Tarrant County, Fort Worth, Texas. My wife and I, that's permanent home. So, here, one thing I was very curious about was to see May 1st is when Texas was, fairly aggressive and starting to reopen. So, I think, and there's time lags, right? So that makes cause and effect analysis more challenging. It would probably be faulty analysis. Like, they reopened on May 1st, and then you see down, 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 down. The chart would tell us don't overreact to that. The chart would say that those consecutive downward points are just noise. Now, in an organization or otherwise, like if someone's got an agenda, they may try to tell their story through the chart instead of letting the chart really tell what Wheeler and others would call the voice of the process. Because, you had that down, 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 and then went up, 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 up. Now, to the point of the question, like this data point, when I saw this data point, I was really concerned because I thought, oh my gosh, is this the beginning of some sort of new exponential curve or a big jump in performance? But if anything, even a couple of weeks after the reopening, we had more than 8 consecutive data points below the old average, which is why I kind of shifted the limits down. This data point to me is suspicious because you'll notice there is a below average point, a very high point, and then 2 fairly low points. Like, to me, maybe there's a reporting error here.
Yeah.
That there's an unnatural variation. And this is where Chris and I think we've both tried to be careful about language. Reported cases is not necessarily the same as the actual number of people who are newly diagnosed with COVID-19, which is different than the number of people who now newly have COVID-19.
Yeah, so I mentioned that early on in my talk because it became revealed probably just in the last couple of weeks, the bailing wire with which our system is held together, where we've got results from labs getting reported to healthcare professionals using faxes, telephone, mail. There's not necessarily a cohesive reporting system where it's happening at the same speed every day. 32 different public health units, 32 different systems for analyzing and processing results, and 32 different mediums for communicate. Potentially, there's some overlap, communication mediums. So now you can see, well, who's on staff on the weekend? Who is on staff during evenings? Who is responsible for making sure the central database, IFAS, is getting updated? So that's why when I look at the daily cases, I'm like, I put in my daily charts now, I have a little warning that some of these numbers in here are probably more than 24 hours old. Use with caution. Like, anecdotally, I know people who have taken 2 weeks to get notified, for example, of their test results. It's a great big it depends. And that's one of the things that bothers me the most about how we're being served with data. It's very poor analysis, it's bare bones, very poor theory, and it gives us no when you have some modicum of knowledge about how systems and variation work, it gives you no sense of confidence about the figures that you're actually seeing. And when you see that they're being used to make decisions against, now you're even more concerned because what is the reality?
Yeah. Let's see. I'm going to put the Q&A information back up here. Chris, have you been in contact with any of the national newspapers? I think your work would help good public health reporters. And the person asked the question, we can follow up via email, is happy to make the effort to help raise their attention.
Yeah. Short answer is, yeah, I've tried, but somehow process behavior charts aren't nearly as attractive as some other charts. So I know that, for example, there is a GP MD, her name is Jennifer Kwan, who's been doing actually really great work. She has been publishing her analyses of the healthcare COVID-19 response data each day. And her charts, just quite frankly, look better than mine, but they're not process behavior charts. They're run charts, which is leagues beyond what's being offered right now. And I think that's great. Where I think they could be improved is getting rid of the 5 or 7 day rolling average. Mm-hmm. And of course, putting some control limits on it in my own biased way. But yeah, the short answer is I've tried to raise the profile on this, but I think that reporters, without having an understanding, like a crash course in why this is more insightful, it generates better insights, it's kind of out there for them to interpret it. They look at this chart and they go, well, what am I really seeing here?
Yeah.
Like, what do these red lines mean? What does this green line mean? And in turn, how do I communicate that to the public? So what I would like to see more is the province actually take the leadership and then set the agenda that way.
Yeah. Well, and so I pulled up, here's the example of the run chart, and I'm just making up a number, but to me, like, a run chart gives you maybe 80% of the benefit of the process behavior chart.
Yes.
But the difference with the process behavior chart is that we're not having to guess if a data point is a meaningful outlier or a signal. And so, yeah, I'd be happy if instead of this, people did this. There was another question. Do you have examples of an executive summary that uses process behavior charts? Yes. So I use a lot of those examples in my book, Measures of Success. I'm going to add a blog post to the follow-up page that sort of tries to help illustrate this, because as the woman who asked the question said, my organization has a multi-page report that shows month-over-month data in tables, and the summary report is pages long. Like, it's just really unfair to ask people to interpret a list of numbers.
Yeah.
And a chart really goes along the way. So hashtag plot the dots. Please just plot the dots.
Yeah.
Let's see. So I think, there's kind of overlap in some of the questions. There's a real minor, or it's a detailed question. Chris, was the backlog that you're looking at, was that measured tests was it tests ordered but not completed, or tests completed but not resulted out yet? Do you know?
So yeah, there's operational definitions that the province includes on that little tear off. There's like a number of footnotes. And the way that they've defined it, the best I can explain it is it's in process. So the test sample has been collected, it's been sent to the lab, and now it is either being run through the machine, or it's waiting to be run through the machine, or it's been run through the machine and it's waiting to be reported, or anywhere in between.
Right.
So it's very gross figures that we're actually seeing. And of course, the lean agile professional in me says, God, I would love to see all 32 queues, or like the different lab queues as aggregated to the 32 public health units.
Right. And
what is the lead time versus the cycle time, as opposed to getting this rolled up figure that kind of obscures all of that detail.
Yeah. There's another question here. In addition to the book suggested, are there other go-to places to get training on PBCs? So I think, there's not a lot of people teaching this methodology, and that's one reason I try to do as many webinars and talks, and that's why I wrote the book. Like, this is a really powerful method that hardly anyone has ever been exposed to. Like, I was really fortunate to get exposed to Don Wheeler's book 25 years ago. A couple of years ago, I went and did his 4-day course that he teaches still a couple times a year. I've done a lot of teaching and courses. I did a course for Memorial Health System in Ohio, which they already had interest in the method, and so I've done some training for them, and I've done some coaching with Duke Health. But if anyone would like to get more detailed training or coaching, I'd be happy to help with that, or maybe Chris and I can help you together.
Yeah,
I've seen a couple. There's a guy I've met, Craig Giggy, who has like an hour-and-a-half long course on process behavior charts. I forget the name of it. It's on one of the learning online course modules. But boy, very rarely do I see process behavior charts. I more often see there's tons of Six Sigma training, which would include control charts. But sometimes the Six Sigma training either doesn't include process behavior charts, or I think sometimes it creates confusion because it teaches too many variants and different types of control charts, when for business data, I think the XMR chart really does the job.
Yeah.
Anything else you would add, Chris, about places to get?
Not really. I kind of picked it up on the streets. A bit roguish, but like when I started getting turned on to the teachings of W. Edwards Deming, one of the first things you run into when you do his red bead experiment is charting that. Now he didn't use originally when he did that to chart the defects that you get in every paddle. I think he used the 3 standard deviations above and below the mean, as opposed to 3 sigma. So that kind of rocked my world when I learned the difference. When I started studying Don Wheeler's stuff, that improved things. But yeah, I basically had to go and learn it from blogs. I learned it from you, and I learned it from, just doing it, trying it. Like that's probably the best teacher of all, is when it's not a hard set of calculations to do. It really, really isn't. You set up a spreadsheet, you can start cranking these out rather rapidly. The nuance in it, or the understanding, you deepen your understanding when you start to piece together, this really isn't about the math. This is about, I have to cast my mind back to the system. Right. So there's a strong temptation to get seduced by the numbers and the perfection of the chart. And then you have to reel yourself back and say, no, wait, what am I seeing? What am I really out here doing?
Yeah, and it's about the behaviors, right? So if you drew process behavior charts with limits based off of the correct calculations, but you still tried to over-explain the noise, that defeats the purpose. That misses the point.
Yep.
For anyone who's still hanging on here, who got to the end of the recording, as Chris said, like in a spreadsheet, you've got data, you calculate an average for a baseline period, and then you've got something called the moving range, which is just the absolute value of the difference between every two data points. You calculate MR bar, the average moving range, and then the lower and upper limits, the calculation is that you take the average plus or minus 3, so this is for 3 sigma, and the estimate of sigma, instead of using a standard deviation, we're using the average moving range divided by 1.128. And 1.128 is a statistical constant from the textbooks. Long story short, it just is. So that's the plus or minus 3 sigma limit. Yeah. And the math is not hard, but the mindset, like in changing the old habit of demanding a root cause for every up and down in the metric, that's arguably more difficult.
Yep.
Let's see, and we still have people on, so maybe we'll keep chatting a little longer, Chris.
Sure, I've got time. I don't want to waste anybody else's time, but there are a few more
people have left if they needed to, and that's fine. But so there's another comment here, question. In the Boston area, our hospital's management team is reporting to staff daily on trends, which is great. And they're happy to talk about the 7-day moving average of the infection rate in Massachusetts, which is reported by the state. The Boston press is also using the 7-day moving average. He says, to their credit, instead of using individual data points. He says, but, it's more of a comment. I'd also like the press and management to try using process behavior charts as he's created. I don't see an easy way to achieve that. As you say, it requires more of an intro course in process behavior charts. So that's part of the challenge, right? How do we introduce people to a concept that they're not aware of? And how do we maybe try to convince them that it's a solution to a problem that they might not see as a problem? Like, again, I think moving average is better than overreacting to every up and down, but moving averages maybe muddy the data and create some other issues as we tried to talk about today. And then there were some other questions, like I think it's a good question. What insights do we need to consider? And neither of us are clinicians or epidemiologists, but if you're looking at case counts, there's limitations on the test reliability. There's 30% false negative rates if there's asymptomatic presentation out there. So I think like looking at the charts, if the data error is consistent over time, that's probably part of the common cause variation in the system. Now, if there was a shift where we suddenly got a perfectly reliable test at a certain point in time, you may see that reflected in the chart. And the process behavior chart would say, hey, there's a signal, and it might trace back to the change in the system was that new test.
Mm-hmm.
One way I would try to answer that. Chris, what do you think?
Well, yeah, and I know that for Ontario's COVID cases, the research I've done is that we're dealing with a range of different test sample kits. Some of them use proprietary components. Some of them are more generic, and that has also some complications for how those kits may need to be adapted to work with the test equipment that the labs have. So what I would be interested in seeing to understand that error rate and how things are working is tell me, for each 32 public health unit, regional public health units, what does that look like? As opposed to aggregating the data. What I've shown in my process behavior charts is the aggregation of the data, which loses a lot of that fine detail. Mm-hmm. But I would imagine in the lab setting themselves, a huge amount of benefit could be derived from looking at that error rate over time, and looking at, well, what are the contributing causes?
And then maybe we'll leave it on this point here. So there's a comment, and I think this will be a good wrap up. I've always found a range to be more revelatory than the average, that it's more actionable. What's your comment, please? So I think I would come back to, here's a chart on Los Angeles County reported deaths. I think it's meaningless, or it's statistically meaningless to say the number dropped from this to that, looking at 2 data points. I think it's more helpful to say the average dropped from about 42 to 35. I think that's more descriptive. And then to Gwendolyn's point, I think showing the chart and saying, look, the limits show the range of where the data is likely to show up. That, yes, that is an even better description of what's happening over time. And so that's where, like if we're doing process improvement work in an organization, there's a risk that somebody cherry picks data and says, oh, we improved. Let's pretend this chart's about a different metric. It improved from 60 down to 22 because we grabbed this data point and we grabbed this data point. I would find that really dubious here. Can I draw? I've got to learn how to. It would be really dubious to say and I've seen people do this for real. The annotate. I got to learn how to do the annotation. I thought I've done this before.
One thing as well is that those limits are calculated from looking at the range between a sequence of data points. So each one of these, we're looking at the delta between them, and then we're averaging that dispersion. So instead of just looking at 2 data points, for example, and saying, well, or looking at a data set itself, what is the range across the data set? We're actually looking at ranges all the way along. We're looking at a very tight dispersion. But there's another kind of chart that's called averages and ranges when you're looking at subgroups that are of a particular size. Here, Mark has generated his chart using a subgroup size of 2.
But so, I was drawing on the wrong screen. But I would caution people in organizations, don't do this. Don't cherry pick a high number and a low number and claim that as your percent improvement. You might fool some managers, but I would say that's not, statistically truthful. I think it's more accurate to say, look, we've improved from that average to this average. I think would be more statistically valid. Let's see, another question jumped in here. Can a process behavior chart be used for things like percentage yield? The answer is yes. You can use it for discrete data, continuous data, ratios, proportions. Don Wheeler calls the process behavior chart, the XMR chart, the Swiss Army knife of control charts. The Swiss Army knife is not good for every job, but it's good for many jobs. And I think it's so much easier to teach one control chart methodology for an organization instead of 6 different charts and a complicated flow chart. Like I've had master black belts who've gone through my workshop say, thank you, boy, this really simplifies things. People's eyes glaze over when they try teaching the second, then the third, and they're like, no. So you could say shame on people for not having the attention span or curiosity, but I really do think it helps. And it's arguably more valid statistically. That's the thing I like about this simplification from 6 control charts down to 1. We're not dumbing it down or doing faulty analysis. It's arguably more valid because the XMR chart is really robust with real world data.
Yeah.
So I want to thank everybody. We had a lot of people continuing to stay on here to the end. We better for worse gave you 90 minutes instead of 60 minutes. But again, on screen here, you can see our contact information and follow-up webpage and our email addresses. So I want to thank everyone for being here. Chris, thank you so much for doing the heavy lifting there with your analysis and sharing that with us. I'll give you the last word if there's anything else you'd like to add.
Nope, simple, short, sweet. Go forth and learn how to make a process behavior chart. Don't be afraid. And start charting any data that you have discomfort about receiving one byte at a time. Sequence those bytes together and see what patterns emerge.
I'm going to say hashtag plot the dots.
Yes.
We're going to throw that in.
Yeah, and let us know. Let us know what you've done.
Yeah. All right. Thanks, everybody. Thanks for being here. Thanks, Chris.
All right. Thanks, Mark.